Isn't that Dr. Wu something? We're here at the Bone and Joint Institute, Hartford Healthcare. It is our show at Hartford Healthcare that we love doing. Sarah Emlaw, Bone and Joint Institute.
She just ran away from
therapist.
us.
She just ran away. They've got patients, man. They're all waiting. There's people need help, man. They got a bad knee, bad shoulder. Got to get these people back out there.
All right, so I was going over some injury stuff today, and honestly, we've been pretty healthy.
You noticed Diarra didn't play a whole lot last night.
Right. Now,
there's something wrong with that.
When I was thinking about local injury stuff, all I could think about was the men's basketball team, and the only body part I keep thinking about is the ankles. These dudes' ankles are very weak.
So you want to talk about Liam's high ankle sprain?
A little bit, because
he doesn't look like he's got a sprain anymore.
And the timing of that, especially of someone like that in this particular
sport.
I
agree with you there too. I think they kept him out. First of all, he's a lottery pick.
Yeah,
they kept him out till they were 100% sure this cat is not injured and we're not going to hurt this guy's career.
Right, and that's some of the ABC. Always be Cruton, because if you see a program rush someone out there for selfish wins,
shame on them. That's disgusting.
That's going to permeate through the recruiting circles, and people aren't going to go to that program because you are not taking care of them. They did perfect by Liam. Perfect by Liam. He came out, dominated last night. That ankle looks really good. But Caravan, I think, is dealing with it, and Hassan's dealing with it. And I don't know how you play defense at the level that they do with those kind of ailments, especially on the ankle, man. Especially on the ankle, especially in basketball as well. But they're going to have to tough it out. I know they will. And I want to ask about Epsom salt. You guys ever do the Epsom salt? Anyone?
When I was younger.
Who told you about Epsom salt?
My mother.
It's always someone older.
Yeah, old people.
It's such an old thing. Right. I know. For just precautionary. I didn't know it until the South, and I'm probably 23 at this moment. So,
do you have to talk on the mic?
No. Well, I was going to give Sarah the headset.
I'm laughing my butt off watching you.
I know, this is
like
funny.
You're doing play-by-play.
It is. It's like that, and it's like
for people that don't know, and I should have described it. So we have headsets like we're actually doing a basketball game,
right?
When we're on remotes, and Ben's being gracious and giving our guests his headset.
Well, sometimes when I give them the microphone, they go like this when they try to talk on the microphone,
I know, and so
we're always on the microphone.
We're like, you have to keep it right in front of your mouth.
So just to make things easy, I give them the headsets, but then I look like I'm about ready to start a freestyle rap battle here in the middle of the Bone and Joint.
Ginger Eminem.
Well, I don't want to flip segments, and I don't want to yell inside the rehab center to get Sarah back on here. But
it's fine.
She just to highlight what goes on out there, because I bet you they're tired of talking about it. And now we've been coming here since what, 2017, 2018?
Since they opened it.
Yeah, since the place got built, and we've got some of the first initial tours, and now we have just been schooled on what they have here. Motion Lab just got a brand new camera set up.
Yep.
Stephanie Barraza was telling us all about it last time we were here.
Well, because we've been coming here so long, the technology is now being updated.
Right.
So that other stuff was out of date.
That's weird to think about, because I haven't seen another Motion Lab in my life. I mean, I know they exist all over the place, but you would think that would be state-of-the-art for the next 20 years.
Listen, what was it, 8 years ago, they sank $150 million to $200 million into this joint.
Right.
Now they're upgrading it, so you're getting the best of the best.
Best of the best.
I like the Alt-G, the anti-gravity thing.
Right.
Where you blow out a knee or you break a knee or something, whatever. You don't have to put any pressure on it. It holds you up, and they can rehab you and get your range of motion back. So Sarah Emlaw,
well, that would have been great for Liam.
Is now joining us, and she's one of the head physical therapists. Some of that stuff has become outdated, including the Motion Lab. What are some of your latest gadgets that you're working with? Aren't you doing like the blood pressure cups and stuff like that? Or
so
cups, not a cup.
Man, I could go off on a tangent here. So I just had a meeting with our Motion Lab team yesterday. So biomechanics, biomechanical engineers, whatever.
It's easy for you to say.
Right. It's a tongue twister. But we have some really cool advanced technology that we are starting to roll out now. So, my babies, the golf swing assessments.
Right.
So we've typically used a markered system where you take reflective markers, put it on the body of
The
12.
ping pong balls, right? Or they're not
No,
ping
no,
pong
no,
balls?
they're like
No.
small.
That's when I did that with Dr. Andrews 35 years
So that's
ago.
like
They used to
1991,
they don't
92?
do that anymore.
Circa
Okay. What were they called again?
They're like little
were-
reflective
yeah.
markers.
Okay,
that
reflective
they
marker.
put on the joints, then 12 different cameras around the room pick up on
And you
these.
were a
They
stick
create
figure.
a 3D
Right.
avatar. Exactly. So now we have a markerless system. So we put sensors on different larger segments of the body, and there's cameras that we can bring anywhere remotely. You want me to catch you at the
that's
driving
right,
range?
They're
right.
We
mobile.
set you
Right.
up and do it on the driving range.
that's
And I just looked
fantastic.
at the report. It is so cool. I'm super pumped. In addition, there's sensors they're going to put in your shoes. So I can see exactly
While I
where.
play?
No. Well, while we're doing the swing assessment.
Right,
okay,
right,
for
right,
example, and this is just golf related, but we're going to use this for other
Can you do it for
sports.
baseball? Can you do it for
Yes,
pitchers?
it will be.
That
That's
would
what I
be
was
That's
thinking,
probably the
yeah.
one that they're
Well, I
working
have
on
some
the
you
most.
can, if you want guinea pigs, I'll bring them here.
Yeah, right.
My 16-year-olds.
But these inserts, they look like a insole from a shoe. We have different sizes. We put
Awesome.
in your shoe, so we can see where your body weight is, where you're putting your pressure when you're swinging, or when you're pitching, when you're about ready to hit a ball.
Now, the old motion lab was just big plates. on
And
the
we
floor.
still have
Oh,
that,
you
but we
still
can't
have
bring that out. to,
Exactly.
like,
Right.
And this is the really cool part: is we can bring this anywhere. I'm so pumped. This for me, especially as a provider, is going to tell me what the golfer is feeling. Right? I can see all your joints and angles. That's really helpful for me. But to actually get a feel of what the heck the person's doing in the swing is so powerful for me to give you proper programming and cues and directions. So I'm
Awesome.
I'm a nerd. This is really exciting. So there's that. We do use BFR here. That's been really awesome.
What is BFR?
Yeah, I know.
Blood.
See, you're speaking
Sorry,
nerd.
thank you,
you
for
know,
that. Great question. I'm
Yeah.
so happy you asked.
BFR.
Blood flow restriction.
Right.
There you go.
Power
So-
cuffs.
Power cuff.
It is a tourniquet that we put on the upper thigh or the upper arm. Depending on that segment, we take it. It can calculate and calibrate to determine what is 100% of blood flow restriction, because we're not going to do that.
Right.
So for the legs, for example, we typically set at 80%. And really, the purpose of this is to pool the blood below the tourniquet, which creates a environment that stimulates the healing. So, for example, we had a post-op ACL. She is track and field. She came in after her ACL repair, and her thigh was probably half the size of her other.
Because of atrophy?
Yeah. Or this was not the leg she pushed off of for long jumping. So I wonder how long it's been,
Right.
atrophied in comparison
Right.
to her dominant leg, for example. So I don't know if this
Right.
is, from the actual tear or just her in general. But within 3 months of using BFR pretty adamantly in rehab alongside the strengthening components, we were able to hypertrophy her quad back to be symmetrical.
That's
or
awesome.
maybe it never was that side. But she came back from break, and I hadn't seen her for the month leading up to that. I'm like, holy cow, like, look at that thigh. Like, that is, I'm just, like,
I got
it's
smacked. I
exciting.
said the same thing.
What else we got? So I just did my dry needling certification this past weekend. So
Nice.
I'm riding
Let's
that
go.
high right now.
do it.
The amount of science that goes into it is just wild. So dry needling is using acupuncture needles. It is not based on the Chinese medicine of like meridian lines or energy imbalances. It is strategically placing a dry needle, and I'll explain that in a second, where there's a myofascial restriction. And it's so intertwined to the neurology of where that muscle's coming from and innervated from back to the central nervous system or your brain or your spinal cord.
Love it.
So if I have someone who's, quad deficient, they're having a really hard time turning it on, yeah, we can use neuromuscular electrical stim to like wake it up. But I can also stimulate the back at L2 or L4, because I know that's what innervates that, as a method, as an extra tool to get that system stronger, to have better communication, to open up the microcirculation to that area. So I'm riding that high right now. I'm really excited to needle people. I know it sounds messed up. But
No, that's great. Hey,
it's
man.
amazing. I'm glad you're saying all this
pig.
because, listen, 40 years ago when I'm in the major leagues, people thought about a physical therapist as just somebody who's like stretching you and doing massages and stuff like that. They have no idea the technology that you use in your day-to-day to get people healthy again and get them back out there. So I'm so glad that you're telling them about the technology and stuff like that. How about the Alt-G machine?
Yeah,
Like,
we're actually looking to get a new one. So ours is updated.
I know. We're so
old. Just same thing though. It's just updated, newer, flashy, right? But the anti-gravity treadmill has been really awesome for people to get them walking normally. So say you fractured your ankle jumping off a rock wall as kids or something, and you're told, oh, just toe touch weight bear. Well, I can get you into the anti-gravity treadmill, take up to 80% of your body weight off, have you walking normal to restore the proper walking mechanics and kinematics so that you're not gimpy for weeks waiting for the doctor to say, all right, we can add some more weight now that the bone's healing more. So that has been really helpful on that front. The technology that's embedded in the anti-gravity treadmill is really cool too, giving real-time feedback. So if I'm in there and I have someone who's walking funny, I can see, are they having a 5% stride difference? Are they only 30% weight bearing in that side compared to 70% at each step they're taking? So it's giving us real-time feedback, which is really helpful for patients and clients to see and correct themselves.
I'm totally scrapping the Epsom salt conversation. We are not doing that anymore. So talk about old school now. Oh my
rest
gosh!
And recovery still
all right, ask her about Liam McNeely.
Well, I was
ankle sprain.
I was going to ask the high ankle and just like and him. And who knows who else is messed up a little bit with their ankles. But in that sport, just talk about the difficulty it is with basketball, with the high ankle sprain and trying to play defense and try to move laterally. And just like people don't understand, you can tape it up, but there's still going to be significant amount of pain there. We're talking like
he missed 8 games.
Eight games.
It was a month of games.
I would say 6 to 8.
Yeah.
I would say 6 to 8 weeks is where he's at.
High ankle sprains are pretty tough because it's really involving really thick, dense fascia that's connecting the two bones of your lower leg.
Right.
And that holds a lot of nerve endings and is very painful. So even though it's high up and you're thinking, well, there's not a whole lot of ligaments there. No, you're right, there isn't. But that syndesmosis is so highly innervated and so painful, and that itself takes a while to downregulate. Hey, another great reason to use dry needling.
So true. So
yeah.
true. Well, I was going to ask you about, I was going to say power cuts. We're friends with Diamond Dallas Page, and we've learned a lot of blood restriction flow from Diamond Dallas Page's power cuffs that he's selling around the world. And
one of his main guys is the WWE wrestler, not Dusty Rhodes, Cody Rhodes.
Yeah,
Cody Rhodes uses that stuff.
All these guys
these guys that are all ripped and strong are now using those blood restrictions.
So his pitch is you can lift so much less weight. You can put so much less bearance on your joints and any kind of other things that you're doing as far as weight lifting with 10-pound dumbbells instead of 50-pound dumbbells with the same thing. Now, put this to my mother's thinking when I'm a kid, you do not do this, son, because you're going to cut off your circulation. And like this is a thing. Like I'm nervous about it and using it in my workout routines because of my mom ringing in the back of my head and that whole concept.
Yeah, there's some heavy science, so I won't get in the weeds on that. But it's not cutting off 100% of your circulation. So
but you don't want to do this on your own.
No. So the systems that we're using are able to calibrate and know and tell us and set it so we know we're practicing safely. And this is probably a misconception too. It's not helping so much your strength or your force output. It's just hypertrophy of the fibers. It's just making them bigger. So That's I see your head turning.
Well,
yes, it can
It's for
help
looks.
for strength
It's not for strength.
initially. So once you're making more muscle fibers bigger, then you got to strengthen into that. But the actual intention of blood flow restriction is to hypertrophy the muscles, make them look bigger.
Dolly
but you
says
still
that.
got to strengthen them.
So I
Because
I used to lift with bodybuilders, and they talked about that. So it's destroying your body so it can recover and heal itself. Is it part of like that that belief that like the lifting to get bigger, stronger, and stuff like that? Is this helping that kind of what athletes are doing to themselves?
I could see that part of the science. I can't say for sure that's so. This all started from a guy doing squats where he felt like he was cutting his circulation, and then he realized his calves were getting bigger.
Right. What country are we in on that? Was it South Korea, I think, or it was somewhere?
Something,
South Asia. I don't know.
But so he explored that, and that's where that all stemmed from. But,
so what part of his leg was he restricting some blood flow?
His
below the knee, above the knee?
Yeah, below the knee.
Okay, below the knee, okay.
I mean, really, so even if I'm just trying to hypertrophy the calf, we're still going to put the cuff at the thigh. But again, we have invested in the technology so that we know we're doing it safely. This isn't something.
Right, I've watched you guys. You have the pressure where you're looking at a computer screen. You know exactly what it is, so these people don't get hurt.
Yes.
I love dry needling, by the way.
I do too.
I love dry needling.
I hate it to myself just because I hate needles. It took me a couple of years to build up enough courage to go to this course, but I did it. I'm a believer, so here I am now.
I love it on the back. I think
love it on the neck.
It does everything that you're saying. Like you're trying to bring the pain around, basically, or move the pain.
I think she has to go though. Right?
Oh, do you?
Yeah,
I'm sorry.
I didn't see my patient walk in yet. No, I had a call coming in, so I ended that. No, the benefit of here,
for
I can
dry
see my
needling, when do you? I wish I could do it every day, even if I'm not hurt. That's how much I love it. But when do you know I need to get dry needled, and how do you set that up?
There's so many different reasons why someone could benefit from dry needling. Anecdotally, for me, I get headaches a lot because I get a tight neck.
Yep.
Going into the weeds of why I think I have neck issues, but there's certain locations that are highly innervated, or what we call surrounding motor points, that we know if I can get to this spot and I know where they are, I'm going to affect a lot of change there. The whole idea around dry needling is it's a stimulant for your body to self-heal. We're basically creating micro lesions.
Right.
If you have a lesion in a tissue, it's going to tell your brain, hey, we got an issue down here, send help. That help is what's going to help repair.
So the dry needling is basically getting your body to heal itself.
Yep.
Correct. Yep.
I love it.
I love it.
Well,
Sarah Emlaw,
thanks
you are
for
the
coming
best.
on. Thanks for moving your schedule around.
Absolutely.
I had a cancellation, so whoever that was, thanks.
Thank you for canceling.